Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics. I know you guys have been asking for a tour of the office, so here it is. Let's go, come on in. So here we go, this is our latest office. This is in Allen, Texas, and we're really proud about this office. So let me walk you through some of the features that I think are really interesting and slightly different. So let's take a look this way. What we do at all the offices now, we love to have our little kind of smile makeover booklet. So this goes through and gives a lot of before and afters of all the work that we've done. And there's also some reviews in here too. So when patients come and sit down, they can take a look at this. Especially with veneer patients, braces patients, maybe any kind of crown patients that are in the front, they get to see some before and afters. And that just allows them to know, hey, we've done this before, they can trust us, and there's lots of reviews so they know other people can trust us. And it just helps kind of build that confidence in us. So that's one thing we like to do at all the offices. It took us a long time to do it, but we were really proud of that. Obviously we have hopefully a beautiful office design that's very important, with very specific colors that Dr. Christine is very good at picking out. And her latest thing is she loves to do mirrors in the office, and that just kind of creates a more open look. So even if we're in Texas, so we can get bigger offices, even if you're in a smaller environment, maybe in California or New York, your offices may be a little bit smaller, but if you add these big windows, it really gives that good reflection and opens it up a lot. So we think that's important. The next thing that we pride ourselves on is plants. And yes, these are real. These are real plants, and we call it biophilic design. And that's a fancy name. I know Dr. Christina has thought of that. She's researched it, but what it basically means is we have a lot of live plants in the office. And that is just supposed to calm down, make you feel relaxed and good, and it helps the patients just feel good. Plus with some good oxygen in the office, I think that's important too. So we like to have that in all the offices now. So we're gonna swing around to this side. I know Melina's gonna try her best to follow me. And so you can see that the office is nice and open, nice and beautiful. And if you come this way, I'm gonna show you the children's area, which we have in every office as well, because we treat adults, 90-some-year-olds, but we also treat the 3 and 4 and 5 and 6 and 7-year-olds. And we want them to be entertained. We don't want them to wait that long, but if they are waiting, we want them to be happy. So what we do, we'll have you come in here, is we always have, I know my voice might be weird in this little area, but we always have something playing. I think right now we have Dumbo playing, and so they can be here, they can chill out, they can be relaxed, and then they can also play video games. We have, I think it's like Star Wars or something playing here, and Mario Kart or something on this one, and so that they can play and be entertained. So I just want to take another look around this way, and you can stay right here, so I just want you to see. So this is kind of what patients see when they come in. They see this nice open look. You have our logo wall, you kind of have the biophilic design on there with all the greenery in there as well. You have some plants over there with some mirrors. So it just creates that nice, beautiful, open feel. Now we're gonna take you and I'm gonna show you how each op is set up. So because it's a little bit different too. All right guys, before we go to the operatories, I wanna show you a couple things because I think they're really interesting, really unique to our office. So let's take a look here. We have the biophilic design like we have everywhere. But one thing that we found, or that I saw maybe like a year or two ago, could be more now, is something I saw at Lululemon I thought was really interesting, really unique, and it is the Our Family wall. And I love this thing. This is probably one of the most interesting things I think is at our office, because we will have a ton of patients come through here, and you would be surprised at how many people stop and read this information. They get to know the staff, they get to know the doctors, they just get to know more information about our office, and it's really interesting. It's good for them, but it's actually honestly good for me too, because I get to know a lot more about my staff that I wouldn't normally get to know just when I'm just talking to them. So a couple things that we have everybody do is we do an About Me section, and that is just where you came from, maybe any of your family history, anything that's interesting about yourself or about the team member. After that, we do passion. What are you passionate about? You know, some people are passionate about art, or some people are passionate about their car, or passionate about anything. We love to get to know that type of stuff, because I think that's really interesting to know what your passions are. Hopefully it has something to do with dentistry. That'd be the best. And then what makes me happy? You know, there's a lot of things that make people happy, and that can help us interact with them more. So for me, you know, it's my family, it's my dogs, Lola and Sophie. I love hanging out with them. There's a lot of things that make me happy, and I think that's just really interesting with anybody, and we get to know them a little bit better. So that I love about our office. So let's keep walking this way. There's some other cool things. One thing that Dr. Christine would hate if I didn't recommend or if I didn't show would be the diffuser. So it's behind here a little bit. And this diffuser, it basically gives that good smell to the office. Because you know, when people are walking in, you know, they look at the office first, they get to see everything. And then they get to see the staff and the team members, and that kind of gives them a good vibe too. But have you ever walked into an office, like a medical office or a dental office or any type of office, and it smells like all nasty and gross, like a library or something? We don't like that. We want it to smell nice and good and relaxing. So the girls have their own formula. This smells like a lemongrass or something type of formula. Anything to help kind of give that good smell to the office. So we got the visuals, we got the smell, we have music, which we don't have on right now, but we just want to have a good kind of please all the senses for our patients. And so before we go to the operatories, there's still something else I want to show you, and it's our console rooms. So for me, I do ortho, so this is really important for me. Maybe if you're doing implants or bigger cases, this would be important for you as well. But we have our console room, and this is in Allen, like I mentioned before, and this is actually our biggest console room, but I would say our other console rooms are pretty big, maybe a couple feet less than this, but very, very similar. In every console room, we have multiple TVs. So if you come this way, you can see that the patient can hang out here. I'm talking to the patient, I'm leaning them back, kind of figuring out what's going on. I'll have x-rays or videos or something playing here, so I can inform the patient as best as possible. Then normally we'll have the patient's parents staying here, or somebody here. Same thing, another TV in case we need to show them anything. And then normally after we've kind of done all that, the treatment coordinator will come here with the parents or the patient and try to kind of sell the case. So we have all these different tools to help the patients become more educated, and they can see everything that's going on. I think I can talk to a patient and tell them, hey, you need braces because you have this, this, and this. And they might go, okay, and I can show them with the mirror and they're like, okay. But if you can show a video of exactly what you're gonna do, that sells treatment so much better. So if you can invest in some good programs, we have Dolphin Imaging, I think it's amazing. But there's a bunch of different programs you can invest in that can help you sell treatment. All right guys, so now you get to see the operatories and see how they're a little bit different than most operatories in most dental offices. We, like I've mentioned before, we love to have TVs. So yeah, we got one up here, I'm not sure if you can see that. And then we also have one straight ahead. Right now it's American Barbecue. I don't even know what that is, but that is Netflix. So we can have Netflix on all the TVs, so patients are constantly entertained. Because you know, when the dentist comes in, they explain the treatment. There's always gonna be that little break in between when the dentist explains the treatment and the treatment coordinator comes in and kind of gets the finances going. So we wanna make sure that they are entertained so they can watch whatever show they want. And not only that, we can have the x-rays being shown on the front TV or the top TV so that patients can see exactly what's going on. So if a doctor like Dr. Adame comes and she says, hey, you know, you have these cavities, or you need a crown, or you need a bridge, you know, instead of just pointing and like having a mirror and trying to figure it out, you can actually see big up on the TV kind of what's going on. You can point it, you can see it, you know exactly what's going on. So there's no confusion. So that is really important for us. We love to put Thrive on basically everything we possibly can. So we have a little Thrive here, these sunglasses. And then, you know what, soon we're gonna have our own earphones, maybe soon, I don't know, maybe. But we have our blue earphones that we give to our patients as well too. We try to have everything kind of themed blue, themed as is Thrive. We also have patient pictures that we can put up on the TV as well. Just as much information we can give to the patients so they know they can trust us, because we are showing them everything and we're just being super honest. All right guys, so let's go check out the rest of the office. All right guys, so now you've seen the lobby, you've seen the console room, you've seen our little kind of like our family area, you've seen the ops. But now I want to just kind of give you an overall view of the kind of back portion of the office. So you can kind of walk with me a little bit here. And I'm going to take you a little bit walk into this area. This is our pen Ceph. Yes, I'm an orthodontist, so we need a Ceph in every single office. Pen Ceph's pretty normal. Pen Cephs are getting more and more expensive. I think when we first started, they were like 20, 25,000. Now they're like double the price. So everything's getting way more expensive, unfortunately, but we have very nice pen Cephs here. We want very good quality. So if you kind of keep walking down, most of our offices are kind of long like this. Each operatory is basically the exact same. We like to keep it very consistent at all the offices, just because we think that's a good setup. I'm gonna walk in here. We already have Karen here. She's gonna be in this. She doesn't even know this, but it's okay. So as we walk back, we try to keep things nice and clean, which she's doing a great job. Thank you for keeping it clean. But I wanna show you guys some other stuff here. If you can keep watching, whatever, nothing, yeah, everything's clean. Okay, but the other thing we think is kind of neat that we have, and we like to do at all the offices, is something called tip out bins. This is where we get to have like our OCD-ness, and we want to make sure everything's nice and clean, nice and proper. And it's a good way to see if we are in stock. So say we have lidocaine and we're not sure if we're in stock, boom, you easily see, yeah, we got enough, we're good. It's just a really, really easy way to kind of keep track of your inventory. So we did that, I think, pretty close to when we started our first office, and we've done that for all the rest of the offices. And we love it, and that is probably the one thing that we've been most consistent about at all the offices. So there you go. So let's kind of turn it around. You're gonna walk by a washer dryer. We want to keep everything clean here, and Kara's being very careful with whatever she's doing over here. And then I'm gonna kind of walk you guys to the back. So like I said, all the offices are pretty much the same. TVs on the top, TVs on the front, and then we just like to have a nice long hallway. And if I can walk you all the way to the back, because this is what I think is the most interesting. So I'm gonna keep walking, we'll keep going. So we have the doctor's office, nothing too special, nothing fun there. But the best part of this office is we have an N65. This is like my boyhood toy. We have Mario Kart, which I am not #1 right now, but I'm pretty close. And this is just a fun way to kind of blow off some steam in between patients or during lunchtime. The TV setup, an old TV, and our N64. So there you guys have it. That is our office. You get to see everything from the minute you walk in to the very back where we don't really show people. Hope you enjoyed it. If you got any value from this, please subscribe. Please comment below, because you know I'm doing my best to answer all your questions, and we'll talk very soon.